Hi everyone, good to see you all again. It's been a while since I've done a video on here, as I've been sort of busy during lockdowns, building my two websites, which I'll be giving you details of in the very near future. So today I'm just going to do a fairly short video talking about breast massage. This is something that I've had, a few people recently ask about, and I wanted to do the video because there's often a sort of a confusion regarding this subject, and regarding the scope of practice among massage therapists and among clients, particularly in this area. Quite often, breast massage is seen purely as, part of a sensual or tantric massage. It's not an area, that is really included in basic massage training, despite, the fact that there are, many forms of tissue dysfunction in the breast area, both for men and for women. So, offering breast massage, therapeutic breast massage, as part of a client's treatment plan, with informed consent, obviously, from the client, and within an ethical framework, can be hugely beneficial to the client. Now, obviously, the therapist must have undergone specialist training in specific techniques and be able to offer medical reasoning for doing breast massage, taking into account both physiological and psychological factors of the treatment. But even then, the most effective, most experienced therapists may still have difficulty in meeting the needs of female clients, and this is due to social beliefs about touching the breasts. So what are the potential barriers to breast massage? Well, probably the biggest one is social perception, due to the sexualization of breasts and connotations of prostitution that unfortunately have been associated with the massage or parts of the massage industry. There are certainly legal and medical implications, and protection of the client. Therapists' competence, experience, and their own comfort levels in terms of providing this. Male therapists in particular, may be concerned about boundary issues when it comes to massaging the breasts of women. Lack of training certainly can lead to sort of uncertainty in terms of what is the purpose of a breast massage. And also, obviously individual clients will have different issues and different concerns as well. And does the client have adequate boundaries? Because we as therapists can have our professional code of conduct and our sort of set of boundaries, but sometimes clients, they just kind of don't have the same boundaries that we do. So informed consent, we mentioned, obviously extremely important, and that comes sort of under working within an ethical framework. Has the client been sufficiently informed about what breast massage involves? Are they able to consent to breast massage, or are they, in some sort of vulnerable category where maybe their judgment may be slightly skewed? The perception of breast massage really can range from holistic integration into a treatment plan to an invasive and potentially abusive procedure if it's performed by an inexperienced and unregistered therapist, who lacks a certain level of integrity. So there's lots of things to think about, both, from the client's perspective and from the therapist's. However, there are many benefits of breast massage. Certainly I've done posts, you may have seen them already, about the use of breast massage postnatally to promote lactation, when mums are breastfeeding, and also to prevent mastitis. It can be great for, reducing pain levels and breast engorgement. So that's one use, and that certainly it's also something that we as therapists can teach nursing mums to do themselves, and obviously that then sort of saves these sort of negative perceptions of breast massage, and if the client's doing it themselves, ethically, obviously it's a sort of much better scenario. Also, if we think about cosmetic surgery, breast massage can be very good after either a breast reduction or a breast augmentation. Although again, this is something that the client can do themselves. Massage has been shown to reduce the risk of capsular contracture following augmentation, which is where the capsular pocket hardens and contracts against the implant, and this is because of excess scar tissue forming and adhesions following the surgery. Now, this contraction can be very painful because the implants will usually become displaced, and it's particularly applicable to implants that are placed under the pectoral muscle. Another really big benefit of breast massage is after mastectomy, or breast cancer treatment. And again, this is, in terms of helping to reduce pain levels, working on, sort of preventing excessive scar tissue formation, preventing adhesions, preventing those tissues sticking together, and, helping to prevent any swelling as well. And lymphedema, helping to reduce by certain techniques, and if you are a client looking for lymphatic drainage, you really need to make sure that your therapist is experienced and qualified in this, because it is a different type of massage. But certainly massage can help reduce lymphedema. Breast tissue, as I'm sure a lot of you know, extends into the axillary lymph nodes, which are under the armpit, and often these will become swollen, if there's infection due to toxins and accumulation of fluid, and this can develop into lymphedema, particularly again after cancer treatment. Other uses of breast massage: it can help. You may have seen a post that I did about yoni massage, and the use of that with women who have been through trauma and have sort of stored negative emotions. And actually breast massage, can form part of this treatment, and help women to overcome trauma. And in fact, breast massage is quite a good sort of prequel, if you like, to the actual yoni massage itself. It's sort of a slightly less invasive area, so it may be used in that way. And again, as with many massages, it can be used to help improve body image, because you know, again, sort of social perception, or, you know, the perfect images on social media. And you know, sometimes even if we've had sort of partners who have maybe made negative comments about our appearance, you know, all these things can affect our body image and how we see ourselves. So this is another area where breast massage can, you know, be quite beneficial. Now, we've mentioned about breast cancer. I'm not going to go into huge detail here about that, but 1 in 7 women in the UK will develop breast cancer in their lifetime. And, you know, this is not only causing problems in the breast or maybe in the axillary lymph nodes, but it can also cause chronic pain around the shoulder, reduced range of motion, particularly in terms of abduction, which is lifting, you know, lifting away from the body. So following treatments such as chemotherapy, radiotherapy or surgery, you know, this can be an issue. We talked briefly there, mentioned about lymphatic drainage for lymphedema patients. Certainly that is a common type of massage used, but also, you know, if you have got someone, for example, who's experiencing chronic shoulder pain, then myofascial release will certainly be beneficial. You know, scar tissue release, certainly, sort of following surgery and radiotherapy as well. You know, those radiotherapy scars can be quite tight and painful for some time. These can all be beneficial to, you know, clients with cancer in terms of overcoming those side effects of treatment, such as we've mentioned, scar tissue overgrowth, you know, removal of muscle and fascia, pain, reduced mobility. And, you know, some of these issues, people think it's just a sort of post-surgical thing, but some of these issues can actually last, you know, for years later, you know, which obviously, as we know, will encourage postural problems, you know, quite commonly sort of a forward head position, shoulder protraction, or, you know, elevation. So if you are a client who is seeking massage therapy to help with symptoms related to cancer, do ensure that you see a therapist who is qualified in oncology massage. Now, I appreciate it's difficult for clients, you know, sometimes you feel like you don't want to ask sort of questions about sort of the therapist qualifications, but it really is important. And, you know, if the therapist is adequately qualified, then really not going to mind you asking. So, and also, you know, in terms of being qualified, there are different levels of oncology training with massage, because a lot of the courses out there, the therapist will still need consent from your consultant to say that treatment, you know, can go ahead safely. There is a course that sort of enables therapists to treat completely autonomously and they don't need, you know, the consultant's consent. So basically you can go in and say, look, I've had cancer, I'd like a treatment, and they can just go straight in and do the treatment. That's not a problem. But there is a difference in these levels of training, so it's always a good idea to check that. You know, and do ask, you know, do ask a therapist, can you see evidence of their training? That's not an issue. So that is a very brief overview of breast massage. I may well do another post more detailed about oncology massage in the future. But for now, yeah, that's sort of just to give you a sort of basic idea of why it would be used. So I hope that's been useful. As always, do feel free to comment, or you can contact me through my Facebook or Instagram pages. I'm on there as the Medical Massage Lady. If you're a massage therapist, I also now have, I'm on there as the Medical Massage Lady Training School. I do also now run courses, both in-house training and online training. Or you can email me at sam@medicalmassagelady.com, and I will also have details of my new websites coming out very, very soon. But for now, that's it from me. Do take a look at my other videos as well, there's lots on here, and I will see you again next time. Bye.